When caring for your child's G-tube, it's important to watch for these common problems. The most common problems you may see include redness, infection, leaking, granulation tissue, and clogging of the tube. Redness or skin irritation. In the first 8 weeks, it's normal for there to be some redness at the G-tube site as it heals. Redness can be caused by leaking of fluid from the stomach, also known as stomach contents, or sensitivity to the tape used around the site. The best way to prevent redness and irritation is to clean the skin once a day with warm, soapy water and apply a barrier cream such as Desitin or Calmoseptine to protect the skin from moisture. Infection of the skin around the G-tube. This is very rare, but should be treated as soon as possible. Signs of infection include increasing redness around the G-tube, skin that feels very warm to the touch, new swelling or tenderness, a bad smell at the G-tube site, yellow or green pus, or a fever more than 101 degrees Fahrenheit. If you are concerned that your child has an infection, please call the surgery clinic. Leaking around the G-tube site. It's normal for there to be a small amount of stomach contents leaking around the G-tube site after surgery. This leaking is usually soaked up by the gauze or dressing and should decrease over time. It may leak more if the G-tube is not properly secured with tape and gauze using the tic-tac-toe method, the balloon is not inflated enough, or it is not fit correctly. Please note, the length of the tube will need to be adjusted as your child gains or loses weight. It's also important to remove the extension tube when it's not being used, since leaving it on can cause unnecessary pulling on the G-tube and stretching of the G-tube site, which may lead to more leaking. Call the surgery clinic if the leaking continues even when using the tic-tac-toe dressing, or if you need to change the dressing more than 3 times a day. They will need to check the water in the balloon and the length of the G-tube. Once you have been trained how to check the water in the balloon, you should check it once every month and if you notice more leaking. Granulation tissue. This is also known as a granuloma and occurs when new inflammatory tissue forms at the base of the G-tube tract. It's caused by irritation from the G-tube, such as when it's moving and rubbing against the skin, or it's too tight against the skin. A granuloma appears red or beefy in color, is tender and moist to touch, and can often bleed when cleaned. If you think your child has a granuloma, call the surgery clinic. Treatment of a granuloma may include the use of silver nitrate to remove the tissue or a topical steroid ointment to shrink the tissue and heal the skin. Long-term care includes ongoing evaluation by your child's G-tube care team to make sure the granuloma goes down in size and heals. Clogging of the G-tube. This can occur when the G-tube becomes blocked by thickened formula, pureed food, or medicine. You can try to unclog the G-tube at home by slowly flushing warm water through the G-tube. Make sure you prime and clamp the G-tube correctly before flushing. Do not put any objects into the G-tube to unclog it, as this may damage the G-tube. If you are unable to unclog the G-tube at home, call the surgery clinic for help. If you have already been trained by your child's G-tube care team, you can change the G-tube yourself using your backup kit. For any questions or concerns, please call the surgery clinic. For more information, visit the website on your screen.